Premature ejaculation, often known as PE, occurs when a person has an orgasm before engaging in sexual activity or within a minute of beginning it. There is no set time when a guy should ejaculate while having sex, but if you ejaculate and lose your erection this fast, you and your partner may feel like there is not enough time to enjoy it. There is no set period when a man should ejaculate while having sex. It's not uncommon for guys to struggle with this condition, which may be annoying and even embarrassing at times. At some point throughout their lives, between 30 and 40% of the population will suffer from it. Therefore, keep in mind that if it just occurs on occasion, there is no need to be concerned about it. A type of sexual dysfunction known as premature ejaculation happens when a man experiences an orgasm and ejaculates semen sooner than either he or his partner would want. This can be uncomfortable for both parties involved. During sexual activity, it frequently occurs either immediately before or shortly after penetration. Both you and your sexual partner may find the experience of premature ejaculation to be quite frustrating, and it will make your sexual lives less satisfying overall. On the other hand, the good news is that it can typically be fixed. Causes of premature ejaculation and the factors that put you at risk. The reason behind this is not completely understood. However, the chemical makeup of your brain might be to blame, at least in part. Ejaculating is typically a quicker process for males who have lower levels of the neurotransmitter serotonin circulating in their brains. What causes premature ejaculation? Ejaculation before its time can be caused by a combination of physical, physiological, emotional, and psychological causes. The following are examples of physical and chemical problems. A diagnosis of erectile dysfunction as the underlying cause. A hormonal issue involving the amounts of oxytocin, which has a role in the sexual function of men. Other hormone levels, such as luteinizing hormone, LH, prolactin, and thyroid-stimulating hormone, TSH, all play a part in sexual function. Low levels of the brain chemicals serotonin or dopamine, both of which play a role in sexual desire and excitation respectively. A penis that is particularly responsive to being stimulated. The following are examples of emotional or psychological causes. Anxiety caused by performance. This may be because you're apprehensive about being with a new partner, afraid about having sex again after a long period of abstinence, lacking confidence, feeling guilty, being extremely eager or stimulated, or any one of several other potential causes. Stress. Relationship issues are present. Depression. Men who suffer from erectile dysfunction, ED, may experience problems with PE on occasion. When this happens, the penis does not stay stiff enough for intercourse to continue. Men can get into the habit of ejaculating too quickly out of anxiety that they could lose their erections. Getting out of the habit might be challenging. It is possible that treating erectile dysfunction will eliminate the need for premature ejaculation. There is a wide variety of drugs available. Premature ejaculation diagnosis. Make an appointment to see a urologist if you have frequent premature ejaculations. If premature ejaculations are causing you anxiety or despair, or if premature ejaculations are having an effect on your relationship. The urologist who is examining you will start by inquiring about your past sexual encounters. Your physician will typically begin by asking you whether or not you've always had the condition, or whether or not it's anything new. They might inquire about your romantic relationships or your sexual history. You should also expect to have a physical examination. If your primary care physician believes that emotional concerns are the root cause of your PE, they may suggest that you see a mental health expert who specializes in helping people who struggle with sex issues. Urologists are medical professionals who specialize in problems that affect the urinary system and may recommend that you consult with one if they determine that the cause of your condition is a physical one. Treatments for premature ejaculation and common home remedies for it. Depending on the underlying cause, premature ejaculation can be treated in a variety of different ways. There are several therapeutic options available. Behavioral treatment, counseling, and pharmaceuticals are all included in this category. The majority of the causes of premature ejaculation are typically treated initially with behavior therapy and/or counseling to assist with dealing with emotional problems, performance anxiety, or other stressors that may be contributing. It is not uncommon to employ more than one therapy strategy at the same time in the course of treatment. The behavioral approaches that aid in ejaculatory control are effective for 95% of the men who try them. To begin and then finish, either you or your partner gives your penis a stimulating massage until you have the sensation that you are about to have an orgasm. Put an end to the arousal for about a minute and a half, or until the feeling is gone. Initiate the stimulation once more, and proceed to perform the process 3 or 4 more times before ejaculating. The squeeze. This method operates in the same manner as the start and stop approach. But when you think you're about to have an orgasmic experience, either you or your partner should apply pressure on the head of your penis until you lose your erection. Before you ejaculate, you should do this a few times. When having sex, some guys feel that they can go longer if they divert their attention to something else. If nothing of those solutions works for you, you can try one of the following. Improve your muscular strength. Pelvic floor dysfunction can be caused by weak pelvic floor muscles. Kegel exercises could be beneficial in helping to strengthen them. By pausing the flow of your pee while it's in progress, you may determine which muscles need to be tightened. Keep your grip firm for 3 seconds, and then let go and relax for the same amount of time. Perform this exercise 10 times, and aim to do it at least 3 times a day. If you wear a condom, it can make you less sensitive to the effects of the drug, allowing you to stay high for longer. Get busy before you get busy. Some guys feel that masturbating a few hours before engaging in sexual activity helps them maintain their composure when engaging in sexual activity with another person. Counseling can help you work through issues such as depression, anxiety, or stress that may be contributing to your PE. Seek out counseling. A psychologist or psychiatrist can help you go through these issues. If none of these are helpful to enough degree, your physician may discuss prescription options with you. Although there are no medications that have been particularly approved for the treatment of PE, there is a possibility that some medications that are normally used to treat other conditions could be helpful. This kind of use is known as off-label. These are the following. Delayed orgasm is a potential adverse effect of antidepressants known medically as selective serotonin reuptake inhibitors, SSRIs. However, these medicines come with a host of unwanted side effects, the most common of which are sleepiness and nausea. They can also put a damper on your urge to have sexual relations with someone. It is therefore feasible that you are exchanging one set of problems for another. It is up to you and your physician to determine what is best for you. Tramadol is a pain reliever, but it also has the potential to delay ejaculation. In cases where antidepressants are ineffective, a doctor might recommend it. Because of the potential for addiction, you should probably avoid using this medication. You can make the head of your penis less sensitive by using anesthetic creams or sprays, which you put on the head of your penis. Keep it on for about a quarter of an hour. Before engaging in sexual activity, you need to wash it off so that you don't lose your erection or cause your partner to lose sensation. Medication for erectile dysfunction. These medicines can also assist men in keeping an erection going. They include sildenafil citrate, Viagra, tadalafil, Cialis, or vardenafil HCI, Levitra. This is the end of today's video. Give your precious feedback in our comment section below. Please like and subscribe to our YouTube channel for more videos.